Okay, so I'm here again with James from Try Harder, looking at a hip flexor stretch this time. And I really want to focus on the most powerful way we can really get into some of those deeper hip flexors, as well as superficial muscles like rectus femoris, muscles which often get really tight in triathletes, runners, cyclists, across the board. These are real go-to areas in terms of trying to open up and affect either knee symptoms or low back pain symptoms. Once we can get into these hip flexors, quite often we see a real improvement in what you're feeling. James, what I want you to do is start out as you are in this half kneeling position. From here, I want you to squeeze your bum as hard as you can, really clench your butt. You should feel that as you do this, your tailbone, your coccyx tilts underneath your body as your pelvis comes into this posterior rotation. Try not to lean backwards as you're doing this, you're still maintaining this tall position, but you should feel that as you squeeze your bum, and you get that posterior rotation of the pelvis, the stretch comes on down the front of the thigh. Can you feel that, James? Perfect. Okay, from here we can hold this for 20 seconds to start with. Then after that 20 seconds, I want you to go through a sequence of contract, relax, thinking about those butt muscles, those glutes. As you contract, you should feel again that butt muscle, those butt muscles getting tight. You should feel that coccyx, that tailbone tucking underneath you, but most importantly, you should feel that stretch down the front of the thigh. Good, so we go through 20 of these. And then from there, once James has done the 20, if, as it is, you can see it's his right leg that's down. If it's his right leg that's down, I'm going to get him to reach his right hand up in the sky. So reach right up there, James. I want you to imagine, James, the right hand side of your body from wrist down to knee. I want you to try and bow that side out. So you're trying to reach the hand over towards the wall there, and you're trying to push your hip out towards me. Okay, I should get a better angle on this. Come around here. There we go. We can really see that you're bowing out as you push the hand across and push the hip out towards me. And can you feel that a bit more down the outside of your body? So up into your obliques. If you really push that hip out sideways, you should feel that up around that hip joint as well. So some triathletes who get quite tight through a little muscle called tensor fasciae lata, a little guy who lives just in here, as he gets tight, the ITB ends up increasing the strain that gets applied onto that band of tissue as well, so the ITB ends up causing problems. This is a lovely little exercise for just beginning to loosen that up. Again, we can go through our set of 20 little reps straight into movements rather than holding this statically. As you're doing this, you're still squeezing your butt, still pushing your hips forwards, and we can throw a rotational component in there as well, James. So come back up to straight, drop your hand. Okay, from there, still squeezing your butt, still pushing your hips forwards. Rotate away from me for a second. Hold torso. You're turning your torso towards the wall, facing, there we go. And then you can rotate in this way as well. So come, after a couple of that, come in towards me. There we go, good. Rotate the far side. Rotate to the near side. Good job. And again, we'll just do 20 of these. The progression here, from that start point, James, you come back to the middle. The progression here, if people feel they want to push this stretch a bit further, from this start point, you can grab your ankles. So if you reach back with your right hand and grab your right ankle, James. So lift your foot off the floor. There you go. Pulling that in towards your butt. If you can maintain the balance, that's where you're really going to feel that down the front of the thigh. Some people, they're just not a lot of people, they're just not ready for this. And in trying to do this, as we see with James, really arching through that lumbar spine, arching through the lower back, simply because of the tightness down the front of the thigh. Something to work on. Give it a go, see how you get on.